Have you ever wondered how the body stops bleeding quickly after an injury while avoiding clots inside vessels? That balance is called hemostasis. Hemostasis literally means arrest of bleeding. It is a coordinated process that involves blood vessels, platelets, and coagulation proteins working together. We can divide hemostasis into 3 phases: vascular constriction, primary hemostasis with platelets, and secondary hemostasis with the coagulation cascade forming fibrin. In this video, we will explain each phase, simplify the coagulation pathways, show key lab tests, and highlight common bleeding disorders and what they mean clinically. We will also demystify important lab tests, PT and NR for the extrinsic pathway and APTT for the intrinsic pathway, and how they guide treatment. Let's begin with primary hemostasis and how platelets form the initial plug at an injury site. Before that, please subscribe to this channel for regular paramedical videos. Primary hemostasis starts with vasoconstriction, reducing blood loss immediately after vessel injury through muscle contraction and local signals. Next, platelets adhere to exposed subendothelial structures using receptors and von Willebrand factor as a bridge at high shear sites. Adhered platelets activate, change shape, and release granules that recruit more platelets and promote aggregation into a soft platelet plug. Platelet aggregation is mediated by fibrinogen bridging between platelet receptors, forming a temporary seal at the injury site. Defects in primary hemostasis cause mucosal bleeding and bruising. Common causes include von Willebrand disease and thrombocytopenia. Now we transition to secondary hemostasis, the coagulation cascade that stabilizes the platelet plug with fibrin. Secondary hemostasis relies on a cascade of clotting factors that ultimately convert fibrinogen into fibrin to stabilize the plug. We describe 2 pathways, the intrinsic pathway activated by contact surfaces and the extrinsic pathway triggered by tissue factor from damaged tissue. Both pathways converge on the common pathway, activating factor X to produce thrombin, which converts fibrinogen into cross-linked fibrin. Thrombin also amplifies the response by activating platelets and additional clotting factors, creating a robust clot quickly where needed. Regulation is key. Natural anticoagulants like protein C, protein S, and antithrombin prevent excessive clotting and keep flow inside vessels. Imbalance can cause bleeding or thrombosis. Next, we explain the laboratory tests used to assess the coagulation system. Laboratory tests help pinpoint where the clotting problem lies. The main screening tests are PT, INR, and APTT. Prothrombin time, PT, measures the extrinsic and common pathways. It is prolonged when factors like 7, XV2, or fibrinogen are low or dysfunctional. INR is a standardized form of PT used to monitor warfarin therapy and compare results across labs, with a typical target range depending on indication. Activated partial thromboplastin time, APTT, assesses the intrinsic and common pathways and is prolonged with deficiencies in factors like 8, EX, IXI, or 12. Interpreting results requires context. Combined prolongation of PT and APTT suggests common pathway problems or multiple factor deficiencies, while isolated results guide targeted testing. Specialized tests and mixing studies can distinguish factor deficiencies from inhibitors, and factor assays identify specific deficits when needed. Von Willebrand disease reduces von Willebrand factor, causing impaired platelet adhesion and bleeding, often in mucosal surfaces like nosebleeds or heavy periods. Thrombocytopenia, a low platelet count, leads to easy bruising and petechiae. Its causes range from decreased production to increased destruction. Hemophilia affects specific coagulation factors, typically 8 or IX, causing deep joint and muscle bleeds and prolonged APTT on testing. Management ranges from local measures and replacement therapy to anticoagulation reversal and treating underlying causes for platelet or factor problems. Key practical points: identify bleeding patterns, use PT/INR and APTT to localize defects, and consult hematology when tests or clinical severity suggest complex disorders. To summarize, hemostasis balances stopping bleeding and preventing clots. Understanding platelets, the Cascade, and lab tests helps guide safe, effective care.